My name is Amir Kazory. I am the Associate Professor of Medicine at the University of Florida in Gainesville, Florida. I just presented my talk in the International Academy of Cardiology Annual Scientific Sessions 2018, which is held this year in Boston. My talk was all about the mechanical removal of fluid in patients with acute decompensated heart failure that we call ultrafiltration, which is a form of dialysis therapy. As you know, the landscape of the therapies of heart failure have changed dramatically over the past few years. One of the fields where nephrologists and cardiologists can work together in an interdisciplinary approach would be the treatment of patients that come with volume overload, congestion, and acute decompensated heart failure. In this regard, we have had a number of good studies that showed ultrafiltration is associated with improvement in fluid removal and patients' symptoms and signs more efficiently than the conventional treatment of heart failure, which is diuretics. In that regard, we have some studies with some of them might have some contradictory results, and there are some post hoc analysis and per protocol analysis that came out over the last year. I provided an overview of these studies and mentioned my idea of how ultrafiltration can be done. What is the best patient population that will benefit from this therapy, and also what the expected outcomes would be in these patients.
Okay, that's 2 minutes. Do you want to add anything else about your, or you think that covers it?
I can add that.
Okay, sure.
There's also an exciting study of over 800 patients that is currently ongoing in Europe, in Germany and Sweden, that will give us some more information on which patient population will benefit from this type of therapy, and if the outcomes that we have always been hoping and expecting will be the same as what we'll see in the studies that, if finished, would be the largest study ever done in this field. Currently, the largest studies are in the range of 200 or 220s, so it would be a major progress in our understanding of how this therapy will affect the patient population that is at risk. I should add that heart failure is a very costly disease, and there is some financial burden on any healthcare, including in the US. As such, these therapies are supposed also to help with that aspect of the care, as most of the cost is related to the hospitalization of patients. So if we can avoid their hospitalization by more efficient treatment when they come to the hospital, this would have some beneficial impact on the financial aspect of therapy of acute decompensated heart failure.